Lots of frontline providers are really struggling to find childcare coverage because everything just kind of happened just like that on a Sunday.
Well, many Canadians impacted by the COVID-19 crisis can stay home with their children. Frontline healthcare workers don't have that luxury. But some University of Alberta medical students have stepped up to fill that void with the indefinite closure of their school.
So we have a small team of students that's working together with medical students from other medical schools across the country in order to match students to families in need.
Once paired, the students will go to the family's home to provide the child care. Students will only be assigned one family and are adhering to the strictest public health protocols. Currently, there are no age restrictions, as even if they aren't certified childcare providers, the students have the essential training.
All of our volunteers have BLS and a vulnerable sector check, so we know that they're able to do CPR, and that piece we don't have to worry about.
Similar services are also being provided in Calgary, Toronto, and Montreal, and as in Edmonton, the demand has exploded.
Currently, we have about 160 some providers who've signed up to get help from us, and we only have about just under 100 volunteers.
So to help the supply match the demand, organizers are extending their reach.
And so currently we're reaching out to dentistry students and nursing students to see if we can kind of help fill the void to meet the huge demand.
The service runs until March 27th, at which time students may be reassigned to clinical duties. And even if this is a short-term solution, students know their efforts are very much appreciated.
We've received a lot of comments from physicians and frontline providers saying, thank you for thinking of us, even if this initiative doesn't work out or you aren't able to find a match for me or you don't have enough volunteers, thank you for considering this.
In Edmonton, Courtney Theriault, City News.